I'm Georgina Russell, the Wokingham Teenage Pregnancy Coordinator. National research shows that young people still find it hard to access contraception and sexual health services. We wanted to find out whether that was the case locally.
I'm Carrie Grainger, Teenage Pregnancy Project Worker for Wokingham Primary Care Trust. Together with Rachel Bentham, a youth worker, we have been visiting several locations in the Wokingham district to talk to young people about how they find accessing contraception and sexual health services. These are the results. Where do young people in Wokingham access sexual health and contraceptive services?
I don't know.
Nowhere. There isn't anywhere to get contraception from. I mean, you could go to the shops or stuff like that, but there isn't nowhere where you can actually get advice for sexual health if you had a problem and you wanted to ask somebody.
It is.
Where?
Doctor.
But that's, I don't know.
Would you want to go to the doctor would you go to the doctor just for some advice? No.
Why wouldn't you go to your doctor?
I don't know, I just don't feel comfortable.
I'm not bothered. I've had like quite a bit of experience with doctors and male doctors and stuff like that, so it wouldn't really bother me, man.
Would you go to a doctor for contraception?
For contraception, I didn't know you actually could, but I thought they'd charge or something.
Do you think if like young people can't access contraception, they would either
Go with
not
that.
not have sex or have unprotected sex? What do you think is the general thing that would
I prefer to go without personally.
I think people would have unprotected sex.
And how comfortable would you feel going into the shop
Be fine.
to ask for it?
Don't bother me.
Yeah.
What about
Some
you?
people might get a bit embarrassed about it, but
Yeah.
personally it wouldn't bother me, but other people, like, they get embarrassed about things like that, get a bit of a prude.
What about like sort of the sex education kind of side of things?
I got bored of sex education.
Yeah.
Teachers that were like cardboard, they're like, here's a condom, here's so and so, here's this, here's that, have a look at it. If you want, you can play with it, but they didn't do anything else. So it wasn't very interactive and it was a bit dull. And
Did you find it useful?
It just didn't really tell you much, it was just telling you how babies are made and stuff like that, and it's not really...
so it should be addressed more in schools, not just an hour session here and there. Proper sessions that explain the relationship problems as well as just sex.
And do you think you got it at the right time?
No.
Do you think it was
By year
too?
7 I forgot it all.
So do you think it was too early or too late?
Too early.
Yeah.
Do you see a lot of young mums in Wokingham?
Yeah, too many.
Yeah.
Way too many.
Most of my mates are young mums.
Yeah, exactly, me too.
Did they want to get pregnant?
No, none of them
Most of them don't.
plan to get pregnant, no. It just happens like...
What sort of reasons?
It could be any reasons from people like getting into a
Contraception.
relationship and not using contraception and stuff like that. So.
Why do we need a family planning clinic in Wokingham?
Because we
There
have to
is
travel
one
to
here.
Reading for boys and there's
Or Bracknell.
all
Right,
Bracknell.
And how would you get to Reading or Bracknell? Do any of you drive?
No.
So you'd all have to take public transport.
If you've got the money.
How long does it take?
Depends.
Well,
Train,
usually
actually,
half
that's
hour
what I
wait
mean.
for the train, 15 minutes to get there.
Anything.
And
Up to an hour
walk
and
to
a
the
half,
place.
yeah. Up to an hour and a half or something, yeah. I don't know.
To get to family planning clinic in
Well, it
Reading?
depends if the train gets delayed or something and you've got no other way of getting there, you just have to wait. So.
If Wokingham could turn around and say, right, we've got all this money, we could provide you with a family planning clinic, where would you want it to be? It directly in town centre?
Town centre, yeah. It's easy access for everyone and like, they wouldn't have to travel to the other end of town or something. It's
In
only
Wokingham,
like 5-10
yeah.
minutes from the train station.
Say you had unprotected sex and
Well,
you needed to go and get emergency contraception. How would you access that?
You have
Are
to-
there any problems?
you have to buy it. It costs £25.
But what if you can't afford it?
And if we haven't got any money,
Really.
we're stuck.
Would you go to your GP for that?
Yeah, I would.
What about you guys? Would you go to...
Have you still got to pay for it at GP?
You'd get it on prescription. What about you guys getting...
I personally wouldn't ever need the pill because I can't get pregnant.
No.
Yeah, to go and get it for them.
Yeah, of course you would go and get it for them because it's like partly your responsibility as well. So
What if it was at the weekend and GP's closed? What would you do then?
You call the emergency doctor.
Do you think they would class contraception pill as a real emergency, that they would come out to you for that?
Not really, no.
Yeah, it should be, because
Yeah, it
if
should.
doctors are meant to be confidential, they can't tell nobody nothing.
Yeah.
What if you were under 16 and you're not?
They have to tell parents.
I hear that.
Yeah.
Yeah, I do.
Most confidential services, yes, they may be confidential, but young people don't feel that.
It's like when you ring up the doctor's surgery, they ask you
Why?
why.
Yeah.
And some of the receptionists are really rude and funny.
So everybody just looks down at young people
Yeah.
like,
Or they're too
Yeah.
young. Why have they
they're
got
too young to
babies?
be having sex and stuff like that, but it does happen, doesn't it? So
You get looks all the
Yeah.
time. It's like I went in there to buy my sister-in-law a pregnancy test and for a look.
Mm.
You're too young.
it doesn't matter whether they're female, male, old, young or nothing, it's just, I don't know, they just look down at you no matter what. So you want someone who's polite and friendly and listens
And
to
knows
you and
about
gives you
it.
advice instead of
Mm.
looking down at you and judging you straight away, yeah.
No, if it's in like small villages, everyone knows everyone, don't they?
Exactly.
That's why I don't mind getting like condom stuff from shops, because they don't know who you are, you don't know that, you're never going to see them again, so...
Everyone's at the doctor's, oh, so what are you down here for? And it's like, oh, do I have to tell you just lie and say, oh, I'm ill?
Because if you've got a disease or something, chances are that everyone would know.
Yeah.
Mm.
It's like, you know, you don't want everyone in the whole village knowing that
Yeah.
you've got a disease or something.
And they should have sexual health clinics like more regular, like closer together, and quite a few of them, because then like you said about villages, people can go to a sexual health clinic or go to another one just outside the town
Yeah.
or something,
Mm.
so that they don't have to bump into people.
You go to get information about stuff to do with sex and contraception.
If you wanted to ask a direct question, you wouldn't be able to look in magazines or, I mean, you might not have access to the internet as well, so it'd be pretty buggered really.
My mum.
Yeah.
Your mum.
Yeah.
All the support workers here.
Mhm.
Right.
Or friends. Family.
Mhm. Where would you go?
I don't know, really.
Wouldn't you ask your mum?
No,
What about your dad?
I don't live in my dad.
So what would you like to see in Wokingham?
Yeah. Sexual health clinic.
Any queries or questions, you can go and ask them.
So
Mm.
when would you like it open?
Open all week.
Can't be 24 hours though.
Mm.
Like.
No, open all week.
Mm.
Because, I don't know, if you need the morning after pull up, like on a Sunday, you can't go to Reading, you can't go to Brantwood.
Yeah.
You can't go to your doctor's because they're shut.
And also, if you're like wanting to have sex or something, you're not going to automatically think, I'll just pop down the doctor's clinic, grab a Johnny, do you know what I mean?
Yeah.
You're just going to go for it, really. So you need somewhere that's close and it's open like on the weekends as well. It's like
Yeah.
it's mainly the weekends anyway. Isn't it? So, boys, I don't know. I think most of them would just tend to keep it to themselves, but girls, I don't know, they talk
Girls
about
go
it
to
with
their
their
friends
mates
or
and
their mum.
and then like, mates actually just go to the doctor or something, so the girls will go or whatever. The blokes,
Boys bottle it up.
blokes won't talk to their mates and say, oh, I've got this wrong with me and this happened, you know what I mean? So
Do you tend to go to your doctor when there's a problem, as opposed to sort of thinking about something?
Yeah.
I didn't even really think to go to my doctor for any sexual health problems. Not that I've really had any or anything, but I haven't really, it wouldn't ever cross my mind to think, oh, I'll go to my doctor's
Yeah.
to ask about that. I'd just go there when I'm ill or something. So.
Who would you or your friends like go to talk about that?
I've got a sex line, yeah. I know a number before, but I've never used it. It's 0800 28 29 30. Some Scottish bird answers, doesn't she?
So you've never tried it, but you know that answer.
She does! We used to piss about when we was
Yeah, she is. It's good for
Yeah.
What do you think of the term family planning?
I think it does need changing.
People go in there, oh, family planning, oh, I'm planning to have 3 kids. Well, actually, we're planning to stop that.
Most blokes would be more worried about getting them pregnant. But I don't know, that's just my opinion personally.
I personally wouldn't like to be infected. Like,
Well,
I wouldn't mind really getting someone pregnant because I would face up to my responsibility. It's like it could be spare of the moment, or sometimes like you go to use one and then like I don't know, people say it feels better without one, which it probably does.
What do you think? Sort of girls that carry loads of condoms.
They get a reputation.
Yeah.
Yeah.
But I suppose it's a good thing in a way, really. They'd look at her and think, oh well, like she's got loads of Johnny, she's obviously a slag, but
Maybe
then
she's using protection.
exactly. I mean, there'd be other girls who haven't got no protection on them, and you wouldn't even think twice, and they'd go out and sleep with someone without nothing. So you don't really feel like anyone's gonna listen to you and actually understand you. Like they don't really care because they don't know you. But that's why you want something like a sexual health clinic where they just listen and then give you advice and then keep it to themselves.
Yeah.
Because other people,
Shoulders crying.
yeah, it's
So all your anger out, your worries.
Mm.
So you're bottling them all up and you get all stressed.
Say it again.
Please, can you
please, God.
Because a lot of things that are for young people, the decisions are made behind closed doors, so it's a bit pointless.
Yeah.
Then they expect you to like the service.
Yeah.
But yeah, because that way they'll actually use the service because they've had some input and they value it more than if, the council have just done that for us, they think we're going to like it so we're not going to. But it's something they've done. They take pride in it.
Yeah.
A leaflet, an advert, or
We should design a leaflet.
the leaflet should actually have explaining the age of consent and where it's best
So just
possible to
because
feel
you
comfortable
have sex-
buying the morning after pill or getting it or buying condoms or pregnancy.
So
the leaflet should include
Contraception.
and where to go in Wokingham.
Yeah.
And people your age will feel more comfortable, as in say, well, people aren't alone out there and they know what I'm talking about. Yeah.